This video is about the Interim Federal Health Program, also known as IFHP. Privately sponsored refugees have special health coverage through the IFHP for their first year in Canada. This is separate from and additional to OHIP, Ontario's health insurance program, which they are also eligible for. IFHP is a federally funded program, and it is administered by the insurance company called Medavie Blue Cross. The program is specifically for refugees. When they arrive to Canada, each refugee newcomer will receive a certificate of eligibility when they go through customs and immigration. It looks like the document on this slide. They will need to show this certificate to healthcare providers in order to access IFHP coverage. IFHP coverage lasts for 1 year from the newcomer's arrival date in Canada, so it's the same as the sponsorship period. The as of date on the document itself can be confusing because it is not the same as the arrival date. This is because the IFHP certificate was issued earlier in the application process to cover the cost of the immigration medical exam, and the same certificate is printed again and given to the newcomers at the airport when they arrive. IFHP coverage is divided into 4 categories: basic healthcare, prescription drugs, dental care, and supplementary healthcare. The basic healthcare category coverage is very similar to OHIP. Think of things like family doctor visits, hospital stays, diagnostic imaging, vaccines, maternity care, and more. It's important to note that while all hospitals accept IFHP, some doctors' offices and walk-in clinics are not registered to accept IFHP. You need to find clinics that accept IFHP in order to receive the coverage. We'll discuss how to do so later in this presentation. Also note that this coverage category is temporary. Newcomers are expected to apply for OHIP to cover their basic healthcare needs within 3 months of arrival. As soon as newcomers get OHIP, they should stop using IFHP for anything that OHIP covers. Prescription drug coverage is broad, but mostly limited to low-cost generics. Prescriptions are of course required to access coverage. In cases where the prescription is not for a low-cost generic drug, newcomers must get prior approval from Medavie, and the prescription must state that substitution with a low-cost alternative is not allowed. IFHP dental coverage is extensive for urgent needs, but it does not work for preventative maintenance like cleanings. Coverage includes things like emergency exams, imaging, fillings, dentures, implants, and periodontics. Please note that newcomers do not need a dental emergency to get an emergency examination, the dental checkup that IFHP covers. They simply need to identify some type of issue for the dentist to investigate, like pain or gum inflammation, to receive a targeted exam. A dentist will then identify any follow-up care needed and request approval from Medavie Blue Cross for additional services. All other healthcare falls under the broad supplemental healthcare category. This includes a bunch of really useful things, like eye exams, glasses, contacts, hearing aids, mobility devices, psychological counseling, speech, physio, occupational therapy, braces, prosthetics, and much more. Note that most supplemental healthcare requires a doctor or nurse referral or prescription and Medavie's prior approval before newcomers receive the service. The exceptions are for eye exams and home care assessments. These services do not require a referral or prior approval. Now let's talk about levels of coverage. There are 3 tiers depending on the category of healthcare being accessed. The cost of basic healthcare is covered 100%, but newcomers are expected to replace this with OHIP within their first 3 months in Canada. The next level of coverage is for prescription medication. Newcomers must pay $4 for each prescription medication, and IFHP will cover the rest. Whether the cost is $15 or $150 for the medication, newcomers will only pay $4 per medication. This coverage lasts for the full sponsorship period. The third level of coverage applies to all other services and products covered by IFHP, including the dental and supplementary healthcare categories. For these categories, IFHP will cover 70% of the fee, and newcomers must pay the remaining 30%. and coverage lasts for the full sponsorship year as well. Please note that service providers must directly bill Medavie Blue Cross. Newcomers cannot pay the fee and then request reimbursement later. So I mentioned that basic healthcare coverage lasts for 3 months and all other IFHP coverage lasts for 12 months. However, there is an exception to this. If newcomers become eligible for other health insurance that overlaps with IFHP coverage, they cannot bill IFHP for overlapping products or services. Rather, they must go through their other insurance. For example, when a newcomer gets OHIP, they become eligible for the Assistive Devices Program and can no longer bill IFHP for assistive devices or mobility devices in the supplemental healthcare category that ADP covers. Instead, they must go through ADP for these products. Likewise, as soon as the newcomer gets OHIP, they should not use IFHP for basic healthcare coverage. I also want to clarify an important point about IFHP coverage and healthcare fees. Healthcare providers who registered to accept IFHP cannot charge more than the maximum amount for a product or service listed on the IFHP benefits grid. We'll discuss benefits grid shortly. Here's an example of what I mean. Say a psychologist normally charges $250 per hour. The IFHP benefits grid rate for psychology states a maximum hourly fee of $205 per hour. Because psychology is in the supplemental healthcare category, IFHP will cover 70% of the maximum rate of $205, and the newcomer must pay 30% of $205. The key takeaway is that the newcomer cannot also be charged the $45 difference between the grid rate and the psychologist's regular rate. If a healthcare provider is unclear on this point, you can ask that they call Medavie Blue Cross to confirm. IFHP provides documents called benefits grids, and these documents list out all the products and services covered by IFHP, as well as details on eligibility requirements, frequency limits, fee limits, and more for each of the products and services. There is one grid per category of healthcare, so 4 in total, and you can access them online through an internet search of Medavie IFHP benefits grids. Please note that the benefits grids are not always updated every year, so you may need to look at a previous year to find the most recent grid for a specific category. There are a few things to keep in mind before making a healthcare appointment when you want IFHP coverage. First, review all the information in the IFHP benefits grids to check that that product or service is covered through IFHP, to understand any additional eligibility requirements like doctor referrals or prior approval from Medavie, and to confirm any maximum fees or frequency limits for the healthcare. You can also call Medavie Blue Cross for this information. Second, not all healthcare providers accept IFHP, so you will need to find a registered provider before making an appointment. A good place to start is IFHP's online provider search tool. However, the information can be outdated, so always call providers to confirm that they still exist and that they accept IFHP. You may also ask a healthcare provider to register to accept IFHP if they don't already. Finally, when booking an appointment, ask about potential additional charges because IFHP may not cover everything offered at the appointment, for example, anesthetic. If you ever have questions about IFHP, Medavie Blue Cross has an excellent client support line. Their representatives speak English or French, are quick to answer the phone, and very clear and knowledgeable. You may also try emailing at the address on the slide, but you'll get the quickest response by phone. You can find the IFHP provider search tool through a simple internet search. Once on the webpage, you can use search filters such as location, provider type, and languages spoken by the provider to generate a list of providers who meet your needs. The search results will include the name of the provider, their location, and contact details. Please remember that these results may be out of date. For example, a provider may have changed locations, retired, or stopped accepting IFHP, so always call to double check. Newcomers have access to another tool called the Beneficiary Web Portal, where they can see their claim history, contact Madavi client support, and view the benefits grids. Newcomers must register to access the web portal using their unique client identifier, or UCI number, which can be found on the IFHP Certificate of Eligibility. As you've now learned, IFHP is a special program just for refugee newcomers, and it provides a lot of coverage beyond what OHIP covers. Sponsors can help newcomers make the most of this opportunity during the sponsorship year by explaining the program and helping them navigate coverage and appointments. Be sure to take advantage of special benefits like eyeglasses and eye exams before the year is up. And remember that it only lasts for 1 year. So if someone is accessing a lot of care through IFHP and will have ongoing needs, please help them figure out how they'll get what they need after IFHP coverage ends. Thanks for watching this video on the Interim Federal Health Program.